In a draft recommendation, the members of the New Jersey Drinking Water Quality Institute say a health-based level of 13 parts per trillion for PFNA in drinking water is necessary. European researchers say PFNA is a suspected human carcinogen and may cause other health problems.
There's also some developmental exposure information. We know that there's maternal to fetal transfer of PFNA and other PFCs, and also to know that infants consume more water per body weight than older individuals, and early life exposure via breastfeeding also occurs.
PFNA is part of the family of chemicals known as PFCs. They are used to make fluoropolymers. In late 2013, the Delaware Riverkeeper Network obtained the results of a statewide survey on the occurrence of PFCs in New Jersey's drinking water supplies. The highest level of PFNA was found in a well that is part of Paulsborough's drinking water supply. New Jersey DEP officials and environmentalists believe the nearby Solvay Specialty Polymers in Thoroughfare is the source. The chemical properties of the substance make it more available to groundwater. Testing has found the chemical in wells in 5 other nearby towns. Elevated levels have also been found in water and fish samples in the Delaware River. Committee members say water treatment systems exist that can eliminate the contaminant.
Removal ratios vary depending on a number of factors, including the initial concentration and presence of other contaminants, but that we can exceed 90% removal and they result in a finished water with a non-detectable level.
Today's draft recommendation is the strictest in the nation for a perfluorinated chemical in drinking water. Environmentalists believe the state DEP must move quickly to adopt the standard to protect public health.
And here we are a year later. It's great that this work is out here, but our concern is the continuing problem of having this toxic pollutant, highly toxic at lower doses than other PFCs, in the drinking water of people in New Jersey still. Now, some towns have taken action in order to remove this. They've done that on their own, independent from government, thank goodness. But at this point, we're wondering, when are we going to see an MCL adopted in New Jersey?
It may not happen quickly, though. State environmental officials say the administrative process takes time.
The commissioner reviews this and engages his staff. Depending on that decision, it begins, you have a proposal in the register for a rule change to the Safe Drinking Water Act. You have so many days of comments, whether it's 45, 60, 90 days, depending on what's decided. I think, is there a minimum?
Yeah, you can do emergency.
30 is a minimum, but you may go out 60 depending on what the decision is.
Do an emergency.
And then you get those comments back, and then there has to be a formal response to comments to everyone. So again, that clock's ticking, but it depends on what kind of comments you get back, how in depth they are, whether or not they shine a different light on what we already know. Even though I think these folks have done an awful lot of work in the health effects, but you just don't know. So that process goes through. And once it's proposed, we have a year to adopt.